we're going to take our pen. You can open up just a touch. So I'm going to mark the vermilion border. That looks good. If you look here, the columella where it meets the cutaneous lip, there's a little groove right there. That is a great place for us to hide our incision. So we're going to go right in that spot. Now, we also have a great place to hide our incision in this groove here. It comes around right to there. We're going to be adjusting it to exactly what she needs. All right, so let's have you open your mouth with that thing. And now, so I'm looking, that looks about right to me. That's going to be about, that's about a third. So I like to pull the lip down, and I'm going to kind of retrace what I just did a little bit lower. That. Like that. I'm going to go a little bit lower on this curve so that we're going to get the lateral edge lifted, and then we get that. So that's our plan. Okay, now you can see pretty well where these are all going to fit together. And I'm going to show you a little trick afterwards too. A little numbing medicine, okay? Okay, now if you open your mouth for me and close your teeth. All right, so now, second branch of the fifth nerve is right about here, right? So what I like to do is aim for there. Sorry. Ooch. Put in a little bit for that block. You did great. And then I kind of tilt medially, and I'm really aiming for right here. Because, you know, I need to get underneath the nose. And then it should be pretty numb about lateral portions. Just the center will be a little bit still. So then I sneak in from here. A little sting. Maybe you won't feel this at all. But you'll feel a little spreading of the liquid in a second here. And then I can kind of slide across. So what I like to do first, put your chin up in the air just a little bit. I usually start on the upside in the center. And one of the keys of surgery, I think, is for all these little curves and turns, it's very important to stop and lift the instrument. If you try and just keep going, you're going to blunt it. What would look like a corner becomes a big smooth line. So we're going to do that like that.
How deep do you go? How much do you take up?
I'll show you. We're going to go all the way down to the, but not take the orbicularis. And here, we're going right in the groove. And then we're going to go right there. Okay, and this groove here. All right, you're going to feel or hear some funny like crackling sounds.
Yeah.
And some funny crackling sounds, and you're going to smell some funny like smoke. All right.
How often do you do this procedure? Like every day?
Yeah, this is about the fourth this week probably. Now what we're going to do is start taking out this section. And what happens when we take out this section is that you have to be able to use all your fingers because you can get some oozing because there are some little vessels in here. Let me see, we're going to be taking this out. And I kind of do it like a lumberjack. So it's cutting at like a little wedge like that.
So that's the muscle underneath. That's
correct.
Okay.
Yeah, you'll see the muscle in just a moment here. Okay, and we're coming down like this.
You're avoiding muscle.
Yeah, I don't need to take any muscle, and I deliberately don't. Now there are, some people who say you should, or you should plicate it, fold it on itself or something, but you're just going to get muscle motion abnormalities, which we don't want, and the movements of your mouth are so precise and important that we don't want that. And then, again, like that. Keep our workspace nice and clean.
You're not going to use that for filler, are you?
Not today, but we do. This is what I would do. I would then deepithelialize this and slide this through the lip.
How do you do your fixation?
Yeah,
Wow.
how do you do that?
I'll show you in a minute. Cautery here. Okay. Let's take a look. Get rid of that and that. And my assistant's going to pull. Oh, if you can see, there's the pink of the muscle there. See that? Everybody, and we have a pretty nice uniform depth. And this little thing can eliminate the need for any kind of big fancy machinery. We have all that big machinery in the room is behind you. But I usually do this, unless I'm doing this with some other procedures, we do it just like you're seeing today, with just local, and she has not had any Valium, Ativan, station, nothing. Now, I have lots of tricks I can do at this point if I wanted to. Having everything kind of open like this, we can make the nose narrower. I can move, if somebody has like a nose that tilts down, we can use little stitch creeps to give them kind of a little mini rhinoplasty for this incision. The more cauterizing I do here, the less bruising she'll have, and the less dripping around the incision, so the happier she'll be. Okay, first one, set the midline. We're gonna go right about there. And now this is gonna be kind of the magical part, because we're gonna see, like a marionette, the upper lip come up. There we go.
I resist urge. I feel my moving, so it makes me want to move my head.
Okay, well, you just relax, because your lip moving is what we're here for.
I know. Okay.
All right.
It's looking great. So
Yeah, it looks amazing.
You're in a really good
Yeah,
position.
you're doing good so far. That comes up like that. There we go. We're starting to get a very pretty shape to the lips there. You can see the years falling off her face, can't you? Isn't that amazing?
That's amazing.
You're not even going to see a scar at all.
No, it's going to heal really well under the... There we go. So you can start to see how this is coming together and starting to be a really nice lip shape. Already very youthful. And now, so this is all of our strength stitches. These are all going underneath to get our lift and take all the tension off.
This is beautiful.
There we go. Look at that.
Seriously.
Do deep and then above. There we go.
How much bruising will she have?
Probably 0. But you will get some redness. You get some swelling. You get some redness around the incision line, which depends a lot on, you know, kind of things I can't control very much, like your own skin, how you heal from things.
Mhm.
Here, we're going to get some more lift laterally. So you want to get the sides up more so it's more balanced. So now we're going to come right in here. Now let's see. That's a good one. And you can see how I can control the nose if you want to.
Oh,
Move it around here. which we
so if you
don't
want to
need.
make it narrow, you'll just stitch it.
Correct, I
in
can
the
do different
mesial.
stitches right there to get it where we want it. Is that stitch, which is Vicryl, is a braided stitch, so it's or a rough stitch, and so it's not going to slip single throw. And if I have a single throw, I have less material under the skin and less of a chance of that spitting that we talked about earlier, and less chance of infection too.
Wow.
There we go.
You don't usually get a dog ear.
No, I haven't gotten a dog ear on this, not for a long time. And the dog ear is where you have excess skin that like you're having trouble finding, and you can get it if you misjudge this. There's a way around it. So if you over-excise laterally, you'll get a dog ear, which is less desirable because the scar will be a little less beautiful. But for her, it's not going to happen. Closing up this.
Beautiful.
You can really see how this is a very fine stitch. Okay, so then I do this as two sections of a running stitch. So that was part one. Part two, very little fine bites. The last stitch was a 5-0. This one is a 7-0. This particular stitch is very good at not leaving any kind of like train track marks or anything like that. A little more than halfway closed now. The reason to do it in two sections is you want to hide any potential mismatches in the corners, not in the middle. So if I have any problem with like dog ear or with slight irregularity, I want it all hidden deep in this groove where no one's going to see it instead of right down the middle. So I'd rather move my way laterally. And we can do this procedure at the same time as a rhinoplasty.